Yeah. Well, it's coming up.
Should be going. Here we go. Alright. We are back on Facebook and should be back on YouTube. Yep.
Yeah,
We're back
looks
on
like
YouTube.
we are back on. There we go. We're coming back here.
There we go. Sorry about that. Looks like we ran into some technical issues. So we'll just start over our questions right now. Again, Dr. Vadivel, Reese Marvell, let's get started.
So the question is, my teeth and gums both hurt. I need help. So it sounds like you have a problem with both your gums and the teeth, and of course, without seeing you, I can't really say your problem is more from the gums or from the teeth. But more than likely, if you're hurting from both your gums and the teeth, you have some possibly the severe gum disease, you have some broken teeth, and some teeth you may need some treatment as far as taking care of cavities. So if you're needing all three, the first thing I recommend is if you happen to be in the Dallas-Fort Worth area, come see us in our office, and we'll be glad to get your gum disease treated and any broken teeth removed as needed, and happy to find a general dentist for you who can help fix the cavities. And if you're not going to be in the Dallas-Fort Worth area, either you go see a dentist and they should be able to take care of that for you, or give you the recommendation for a periodontist as needed to have your problems treated. So either way, if you're in the Dallas-Fort Worth area, come see us, or if you're in any other part of the country or in the world, go see a dentist and they should be able to take care of that for you. And your problem seems like a multi-problem and it needs to be addressed in multiple areas.
Yeah, if you have anything wrong with you, something feels like hurting, stop on by, we'll take care of you. All right, let's go to another question from Facebook. Let's go to this next one from Miss Angela L. Morgan. Her question is, I have Crohn's disease and my teeth are decaying badly and broken into my gums. What can I do?
So the question is, I have Crohn's disease and my teeth are decaying badly and broken into my gums. What my question would be is, in addition to the Crohn's disease, do you have any other medical issues, or are you taking any medications, or you have any other medical conditions that could be contributing to your badly decayed teeth as well as the gums? Just like I answered in the previous, just like I mentioned in the previous question, if you have both gum problems as well as the teeth problems, depending on the severity of the teeth problems and the gum problems, more than likely the gum problems need to be addressed first. If you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you. Or if you're not in the Dallas-Fort Worth area, definitely go see a dentist, and sometimes the dentists themselves, they are able to treat both the gum problems as well as the teeth problems. But once they take care of the gum problems or possibly remove any broken teeth, and they should be able to fix some of the decayed teeth. Going back to your question on how it could be related to Crohn's disease, can that be related? Yes, absolutely, it is possible it could be related to the Crohn's disease. But I don't want to just blame everything on Crohn's disease, and I want to find out there are other contributing factors that could be contributing to your decay and the gum disease, and either us or if you go to your dentist, one of us should be able to help you. And it is very possible that we should be able to fix your teeth for you.
All right, let's go to a question from Cora now. This one is, do gums recede with age?
So the question is, do gums recede with age? Yes, they do, is the answer. Does it always happen? Not necessarily. So in other words, you cannot blame the gum receding always to the age. So I have patients in my office, they are about 80 and 90 years old, they got zero recession. I got patients in my office and they are 10 to 12 years old. You have seen them for braces, and even before they get the braces, they got some gum receding. So the gum receding could be due to a multitude of problems, and they could be due to either gum disease, or it could be the position of your lip, or what we call it as a frenum attachment, or it could be the position of your teeth, or it could be the way you grind or clench your teeth, or it could be due to the aging process, or other multifactorial, or including the brushing technique. So there are multiple reasons to why you could be getting the gum recession. So not necessarily always it is related to the age. Again, when you go to your dentist, more than likely your dentist should be able to address the problem. But if you want to absolutely find out what could be the problem, or what are the best ways to treat that or fix it, and more than anything else to prevent that, or if you happen to fix it and how to prevent this from reoccurring, my recommendation is you go see a gum specialist or a periodontist, and they should be able to help you. And if you happen to be in the Dallas-Fort Worth area, come visit us at Implants and Gumcare, and we'll be happy to help you anytime.
Yeah, whether it's your gums, your teeth, we'll help you figure out what needs to happen and what we can do to help fix whatever's going on. All right. Next question, let's go back to Facebook. This one comes from Mr. Nathaniel Coker, and his question is, my gums are inflamed. How can I treat it?
So the question is, my gums are inflamed. How can I treat it? So the question goes back to you. How do you know your gums are inflamed? Some people come and see me, tell me, oh, I got some redness on my gums, doc, and it could be just like a very, very mild redness on the gum tissue. It may just go away just with brushing. But I do have some patients that they have some redness that has been going on for a long time, and then sometimes the redness even bleeds. So I tell them, hey, how long have you noticed, or I ask them, how long have you noticed your gums bleeding? And they say, well, I have not noticed any bleeding at all. Or they say, oh, just off and on. So what I do is just like I'm going to do it with Reese right now. Reese, can I borrow your hand?
Yeah, sure.
Okay. So, hey Reese, if I touch your hand is not bleeding right now, correct?
Correct.
So what if I touch your hand right here, and if it starts bleeding, is that normal for you?
No, it's not normal.
So is that acceptable that if it starts bleeding when I touch your hand?
No, that's not acceptable. I want to get that checked out immediately.
Absolutely correct. So that's the same thing. So some patients, when they come to me, they say, well, it doesn't bleed, but it does bleed when I brush. Or when they tell me, doc, it doesn't bleed, only when my hygienist checks them or touches them, or when you touch them, it bleeds. So just like I was demonstrating on Reese, and you don't want your skin to be either bleeding by itself or when you touch. So either one of those are indications that you may be, you may have some, or you definitely do have some gum disease. So answer your question, my gums are inflamed. So when you say the inflammation, if the inflammation is very, very mild, more than likely it may go away by attending your dentist on a professional cleanings, or if they are inflamed, like what we call it as a moderate to severe inflammation, it could be due to a variety of reasons, including gum disease or a periodontal disease, or it could be some bite issues, or it could be some broken teeth, or it could be because of your partial denture, and it could be a denture you're wearing. So for these variety of reasons, unless you go to a dentist, it is almost impossible for us to tell why your gums are inflamed and what is the best treatment to fix that. So if you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you. If not, go seek care from a dentist or a gum specialist or a periodontist in your area, and they should be able to help you.
Yeah, we'll be able to diagnose you, help you out, and figure out what needs to be done. All right, let's go back to Cora for another question. Can a rotten tooth be pulled at home? That's number 16 right there.
So the question is, can a rotten teeth be pulled at home? And I see you guys, you can see, you guys can see me smiling. It looks like, or sounds like, you guys want to take me out of business. And I'm just kidding, guys. My recommendation is this is not a DIY, do-it-yourself procedure that you want to do it at home. Can a tooth be pulled at home? Has any of my patients done that in the past? Well, when you have some severe gum disease, sometimes you can't just stop the tooth from just falling out. It just automatically comes out by itself. So in that case, if it automatically comes out, can you just take it out and then just bring it to the dentist to make sure that you have not done any serious damage to the teeth on the either side of this tooth or any other parts of your mouth? That is one thing. And the second thing is, if it is close to even coming off, and I have had several patients in my mouth, hey doc, this tooth has been loose for like almost 5 years or 5 days or 10 days or 10 months, and I'm just trying to pull this out. I can't, like it hurts like hell. So you don't want to be hurting like hell when the infection starts to spread. So as soon as you start to see a tooth becoming loose, and I immediately want you to go to the dentist or come and see us if you happen to be in the Dallas-Fort Worth area at Implants and Gumcare. We will be able to help you. So to answer your question, can a tooth be pulled at home? And the answer is no. And my recommendation is, don't hurt yourself, and this is not a do-it-yourself procedure. You can do it at home. And also one other thing, and I just want to take the opportunity to mention that some people have all sort of dentists, like, and I'm sure you probably heard it in the news, and we live in the Dallas-Fort Worth area in Texas, and this has happened many times in the Dallas-Fort Worth area. They go to a dentist who practices at their apartment. So we have some overseas dentists who came from across the border, and they don't have a license to practice in Texas, but they are practicing in their apartment. And guess what? One of the patient went to the dentist who was practicing in their apartment. They broke the tooth, and now they don't have the proper tools to remove the broken tooth. Now the patient was sent to us by another friend to have the broken tooth removed. And I'm sure you guys probably heard this also in the news. You guys are familiar with the vampire facial. This was in the news a few months ago. There was a clinic in New Mexico. This was a spa and a facial aesthetic clinic. A patient went to this clinic within the U.S. in New Mexico. The patient, multiple patients, not just one patient. I want to say like it's almost like about 30 to 45 patients were diagnosed with HIV or infected with HIV when these patients went to that particular clinic. So you want to make sure that you're in good hands with a dentist at a proper facility. That way you can prevent any sort of problems like HIV or other infectious diseases. Again, if you're going to pull your tooth at home, and make sure that you're not using dirty instruments, because the last thing you want to do is save some money by pulling your tooth at home. Now you got some serious infection. Now you're going to spend thousands, and if not, like if you end up with the hospital, it may end up costing you millions of dollars to have the tooth or the infection resolved. So do not do it at home. Go to your dentist or come see us, and we'll be able to help you.
Yeah, yeah. If you're thinking of doing any trying at home surgical procedures, leave it up to us. He's got the training. He's got the education. He's been doing it for a long time. He'll take care of you.
Thank you, Reese.
All right, back to Facebook we go, and this one comes from a Miss Felicia Warren, and her question is, do you do dentures?
So the question is, do you do denture? Yes, we do. So the question becomes, it's not a matter of whether we do dentures, and we make it even better than a conventional denture. For example, and this is a conventional denture right here. So conventional denture, I tell my patient, this is more like a flip-flop, so you just remove it, it's almost like a flip-flop, and it doesn't stay in your mouth properly, and it's sometimes referred to the grandma denture. You have to take it out, and then you have to leave it in the cup overnight. We don't want you to be experiencing those sort of problems, and we want you to be leaving the denture in your mouth all the time. And not only that, and also we want some security when you wear the denture. So what we recommend normally is what we call it as a snap-on denture. For example, these are the implants that you can get either in the bottom or on the top, and then these are the snap-on teeth that we call it, or implant retained dentures. So what you do is like you snap them on. You can see these are like buttons. So you just snap them on like this. I don't know whether you heard the click or not. That's how it clicks. So it is so hard to remove. This is the implant denture. This is the regular denture. So depending on what your budget is, not necessarily you need to have a denture that is removable like this, even with the implant, but you can have some completely fixed teeth. For example, these are the completely fixed teeth you can get. These we call it as an implant retained bridge, or sometimes people refer to this as an all-on-4 or an all-on-6 or an all-on-8. So the question to you is what type of dentures you want. If you want a simple denture like this, yes, we can do that for you. Or if you want an implant denture like this, or a snap-on teeth like this, we can do it for you. Or if you want a completely fixed solution like this, we can have a completely fixed solution also, like an all-on-4. So again, if you happen to be in the Dallas-Fort Worth area, come see us, or just talk to your dentist or a dental specialist or an implant specialist in your area, and they should be able to help you.
Yep, we're not just extractions or implants. We also make you your dentures. So come on in. All right, let's go back to Cora again. Does toothpaste really cause osteoporosis? What should I check for while purchasing a toothpaste?
So the question is, does the toothpaste cause osteoporosis? What should I check for while purchasing a toothpaste? So this is a two-part question. Does the toothpaste cause osteoporosis? The answer is no. So we don't need to revisit that part of the question. The second part of the question is, what should I check for while purchasing a toothpaste? For the most part, if you have decent or healthy teeth, all you have to do is like make sure that you are purchasing a toothpaste with some fluoride, decent fluoride in it. For example, Colgate with fluoride or Crest with fluoride. That should be pretty much like most of the patients need. If you need something different, for example, if you have sensitive teeth, can you buy something like a Sensodyne with some kind of a fluoride or a replacement fluoride? So yes, you can do that as well, and that is also possible. Can you buy a toothpaste purely with baking soda? Possibly yes, and it depends on how good you are able to take care of your teeth. But for the most part, we recommend for most of our patients any toothpaste with some fluoride in it, because the fluoride is going to give you some kind of like an added protection against your cavities. For example, if you have a metal surface, you want to paint that with a primer or like some kind of a paint to protect that from rusting. The same thing, the fluoride is going to give you the added protection like a primer or like a paint on the surface of your tooth to give you that added protection. Or if you happen to have any type of starting cavities or an initial cavity, the fluoride is going to do what we call it as a remineralization, or like form some kind of a minerals by attracting to your tooth surfaces or by acting on the tooth surfaces to form some kind of a minerals that it can cross-link and form that protective layer that will help you preserve and keep your teeth for longer. So to answer your question, so what should I check for while I'm buying a toothpaste is to check to make sure that the toothpaste has some fluoride in it or some kind of a replacement to the fluoride that will help protect your teeth for longer.
Yeah, always make sure you use toothpaste because that's really important.
That is correct. Yes, sir.
What toothpaste do you use, doctor?
I use the Colgate with some fluoride, the regular toothpaste. Yeah.
There you go. Straight from his mouth.
Yeah.
All right. Let's go back to Facebook. Let's go from our question from Mr. William Morrison, and his question is, how much are implants and bridges?
So the question is, how much are implants and the bridges? So it really depends on what kind of implants and what kind of bridges that you need, or how many implants or how many bridges that you're going to need. For example, in this case, and I'm going to show you an example right here, and this patient or this model has a missing tooth right here. All you're going to need is a one missing tooth. It could be as low as just the implant cost itself. It could be as low as about $1,500 to $1,900. And if you need a tooth or a connection, or what we call it as an abutment or a tooth on the top of that, depending on what type of abutment, what type of crown that you're going to need, that may cost you an additional about $800 to like about $1,500. So the total cost of the implant can run anywhere between $2,000 to $4,000 depending on the place that you go to. Of course, us being the specialist, and we are the experts in doing the implant, our cost is going to be slightly higher as a specialist, and that is for the one implant. So if you need multiple implants, for example, in this case, this model, as I see here, as I show you here, you have 3 missing teeth, and I don't know how well you guys can see this. So when you have 3 missing teeth, so a lot of times these 3 missing teeth can be replaced with 2 implants, one in the front and one in the back, and you can put 3 teeth on the top of that. So in this case, you're going to need 2 implants and the 3 teeth, just like you may see in this model right here. 1 implant in the back, 1 implant in the front, and the 3 teeth go on the top. And the advantage of doing either the 1 tooth in the front or the 3 teeth in the back, or doing these type of implants or bridges, is you want something that just going to look, feel, and function like a natural tooth. So the benefits come for a cost. So going back to your question, how much does it cost to do an implant or a bridge? So a single implant can start as low as about $2,000 and up. And as specialist, and our cost may be slightly higher. If you go to our website, implantsgumcare.com, we have some detailed cost on how much would cost to do the procedures in our office, and we will be happy to help you. Or if you happen to be outside the Dallas-Fort Worth area, talk to your dentist or an implant specialist locally, and they should be able to help you.
Yeah, and those higher costs might also because you're paying for that expertise from us and for the quality.
Well, as you always know, you get what you pay for, right?
Yep.
So if you happen to, if you want to do the best quality of implants that exist, and then make sure that you're going to see a specialist, and then also do some research on what kind of implants they're going to be using, whether those are implants from what we call it as, I call it hot from Sweden, because Sweden or the US are the leading manufacturers of those implants. So we use in our office all the time the implants that are either from Sweden or from the US. There are some generic implants available there that are made from all over the world. They are not going to cost as much to begin with, but the research on they have not been researched as good as these type of the implants from Sweden or from the US. So make sure that you are going to attend a specialist to get this taken care of.
All right, let's go to another question. This one comes from Mr. Matt Williams. His question is, I have 4 rotting teeth, my front 4. I don't know if I should have implants or root canals and crowns.
So the question is, I have 4 front teeth or 4 broken front teeth. Should I consider doing root canals and crowns, or should I consider removing those teeth and do implants? So the answer will be, it depends on the extent of the damage to the 4 front teeth. So if, let's say, the 2 teeth are completely damaged and the 2 teeth are damaged for the most part, would that be a best option to remove all 4 of those front teeth and place 2 implants and then give you a total of 4 teeth? Just like I showed you earlier, you can have 2 implants for the 4 front teeth, one on this side, one on the other side, and you can replace the 4 front teeth with an implant bridge. Or let's say of the 4 front teeth and they are not badly broken and they have some decent sized decay, that needs a root canal, can you possibly fix them with the root canal? Yes, you can. And then after the root canal, more than likely, depending on the extent of the damage, you may end up needing a crown, or sometimes you may not need even a crown. So depending on that, you can make a decision. Of course, without seeing you, we can't really tell you the root canal and a crown or an implant is going to be the best option. So again, if you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you at no additional cost to you or no cost to you at all. Or if you're not going to be in the Dallas-Fort Worth area, go see a dentist or visit an implant specialist or even a root canal specialist, and either one of them should be able to help you.
All right. Let's go back to Cora for another question. Let's see. Does receding gums mean bone loss?
So the question is, does receding gum mean bone loss? For the most part, yes, because I always tell my patients the bone, or the gum is almost like your skin. So the skin stays on the bone, for example, or maybe on the fat, right? So if you become skinny, the skin kind of looks really thin, and then you go down, the skin goes down because it goes down along with the fat, or it just stays on the bone because there is no more fat tissue there when you become lean. So the same thing, the gum stays on the bone. Anytime you have a problem with the gums receding, more than likely the bone went down. That's the reason why the gum went down along with it. So part of the question that you may have asked, because is it possible to correct if there is a bone problem? Sometimes, yes, you can correct the bone problem. So you correct the bone problem, or when you correct the gum problem, you correct the bone problem underneath to bring the gum back. So that way you bring the bone back and you bring the gum back also. Sometimes it may not be possible that you're able to absolutely correct the bone problem. Sometimes you just bring the gum tissue up, and we call it as a connective tissue attachment. Do you really need bone under, or can you maintain a tooth without some bone under, just with some good healthy gum tissue? Underline, good healthy gum tissue. So as long as you have good healthy gum tissue, can you manage with no bone under? Possibly yes, as long as you maintain a good healthy gum tissue with frequent professional cleanings, good home care, and all of that. So to go back to your question, do gums recede with do gum receding mean bone loss? Yes, gum receding means bone loss, and the best thing that you do is you seek an attention from a periodontist or a gum specialist in your area. If you happen to be in the Dallas-Fort Worth area, come see us. If not, seek an attention from a local gum specialist or a periodontist, and they should be able to help you, whether you have a pure gum problem or you have a bone and a gum problem. Either way, how they can help you to treat and help you keep your teeth possibly for the rest of your life.
All right. Let's go back to Facebook for another question. This one comes from Yvonne Galindo. Her question is, I really don't know if I need implants or something else. I had my jaw removed and replaced with my fibula bone, so I need advice, just needing expert advice.
So the question is, I really don't know whether I need implants or not, because I had some part of my jaw removed for a medical condition, and the jawbone that I had removed was replaced with some bone from my leg, and I need some expert advice on whether I need implants or not. So to answer your question, if you have any missing teeth, and if you're suffering because of the missing teeth and you're not able to either wear the denture properly, or you're having some problems with the chewing or able to function properly because of, despite having a good set of teeth, then definitely you need implants. So the bottom line is, the implants are going to help you replace your teeth, and the most important thing about the implants are the closest replacement to the natural teeth. They are going to look, feel and function like your natural teeth. And if you happen to wear a denture, and implants can help secure the denture in place. So to go back to your question, can you have implants despite having part of your jawbone reconstructed with the bone from your leg? Yes, you can. So who can be the best expert to replace or fix your jawbone with some implants to secure some good teeth or secure the denture that you might have? The best recommendation is you go see the reconstructive surgeon, whoever did the implant. So they will be the best people. Either more than likely they are able to do the implant themselves. For example, I know a lot of oral maxillofacial surgeons who are reconstructive surgeons. They're able to do the reconstruction for any type of problems that you're describing, the part of the jawbone being removed and bone being taken from the leg, and do the reconstruction. Not only they do those type of reconstruction, after your bone becomes stabilized and they are now able to go back and put those implants also to reconstruct either your teeth or to secure your denture. So my recommendation is the best experts that you should go see are the reconstructive surgeon to begin with, and either they can do the implants for you, or if they are not able to do that for you, they should be able to recommend somebody locally or they work with to be able to get those implants done for you.
All right. Let's see. Another one from Facebook will do. Let's see. This one comes from Isaac Nyachwaya. His question is, can I get my teeth straight without getting braces?
So the question is, can I get my teeth straight without getting braces? So when you have teeth that are crooked, there are multiple options that are available. So the most common options most people know of are the braces. And some people, because of the age or because of some fear factor or because of some socioeconomic social factor, they don't want to wear braces. For example, I do have a lot of adult patients in my office, and they say, well, doc, I don't want to wear metal in my mouth and I feel like I'm too old for the braces and I want to get some like a veneer. I tell them, hey, veneers may not be the best option to fix the crooked teeth all the time. And because anytime you do veneers or crowns, you're breaking down or you're soldering down your teeth, and those are the natural teeth, and if you can leave the mother nature alone, that is the best way to straighten your teeth, which will be some type of braces. So going back to what I commented earlier, if you do not want to wear the traditional braces, which look like a metal factory in your mouth, or you don't like the fact that you are going to have some metal in your mouth showing all the time, you can have some type of aligners. We call them clear aligners. For example, Invisalign. It is another option. Sometimes, depending on the severity of your crowdness, you may be able to talk to your dentist or the orthodontist whether you can wear those aligners maybe just at night or maybe other times during the day, that when you're not in front of people, that way you can still align those teeth with no major braces in your mouth all the time. These are removable aligners, so if you don't like them when you go to a party or something, or when you have a presentation in your office, or when you're in front of people, you can remove those aligners for a period of time. So those are the two best ways to correct your teeth. One is, of course, the braces, and the braces come in two ways. One is the traditional braces, and then the other ones are the aligners or the Invisalign. So if you don't like either one of those options, most patients say that they don't like that option because it comes with a commitment and also comes done over a period of time. It takes about sometime up to 12 months or 18 months or up to 24 months. So if that is the case, if you absolutely don't want to do any or consider any type of braces, then the other option is talk to your dentist and then see whether they can do any type of veneers or crowns. My recommendation, based on seeing several of those things going bad over a period of time, including the crowns or the veneers themselves going bad, or you have some gum problems over a period of time, I would recommend you avoid them. But if you are able to get them done professionally and in the best way possible, and you are very religious in about keeping your dental appointments, keeping your cleaning appointments, and doing your professional cleanings plus doing your home care. Of course, you can do veneers or crowns, and those are a good option also. So, to going back to your options, can you straighten your teeth without getting braces? Yes, the answer is yes, you can do that, depending on the option. Again, can you always get by without braces? The answer is no, because if you got severe crowding, sometimes it's not possible to get these veneers or crowns, and they may not be the best option to correct the crowding.
Yeah, and if you have some crowding, I guess we could always extract those for them, and then
Absolutely, yeah, absolutely.
Yeah.
Extraction is another option also, but it will be the most aggressive option. Yes.
Mm-hmm. Or you could just do implants for the whole mouth, couldn't you?
Yeah, possible. Yeah, but again, that's not possibly the best option. That would be the most aggressive option.
Mm-hmm.
Yes.
All right. Let's see here. Next question. This one comes from Mr. Carl McBride off of Facebook, and it is: I wear upper and lower dentures now. Is it still possible to get the ones that snap or stay in place?
So the question is, I wear upper and lower denture now. Is it still possible to convert them into a snap-on denture or like a fixed teeth or a screw-in denture? Great question, by the way, and absolutely it is possible. So, as you might know, the implants have been popular only in the last about 10 to 15 years. 10 to 15 years ago, or maybe 15 to 20 years ago, the dentures were the most popular thing. So whenever you got missing teeth, you got all the teeth go back, you remove all the teeth, you get a denture. So we have a lot of people in America. It's about 40 million people in America. I'm sure you guys know the population of America is about 400 million, and about 370 to 380 million to be exact, and then about 40 million, about 10% of the population. That means 1 in 10 people that you see are walking with this denture. So that's a significant number of people are walking around with this denture. So to be able to help them, yes, implants are the best option. Not only that, just because you have a denture, it doesn't mean that now we cannot go do the implants and then retrofit either the same denture or make a new denture for you to fit some implants. So the option is, if you have the denture, either we can do some implants for you to retrofit the old denture that you currently have, or if the old denture is too bad, you may not want to invest money on remaking, you may not want to invest money on retrofitting that denture into the new implants you're putting in. My recommendation is to consider doing new implants and at the same time new denture, or possibly either what we call it as a screw-in denture, or even we can make some completely fixed teeth for you. So depending on what your oral status is, what your condition of your mouth is, what is the condition of your jawbone is, we will be able to help you with putting in some implants to convert that old denture onto a snap-on teeth, or we can do implants to completely do a new denture or a screw-on teeth or a fixed teeth for you.
Yeah, let's get you out of those retro dentures and get you into some nice new implants.
Absolutely, yes sir.
All right. Let's go back to our final question from Cora. And this question is, when is a tooth called dead? What needs to be done for the dead tooth?
So the question is, when is a tooth called dead? What needs to be done for a dead tooth? So when you have a cavity and the cavity gets bigger, and sometimes you start to hurt, or sometimes you may not be hurting, you may go to the dentist, and at that time the dentist may tell you the cavity is too bad or too big. I'm glad like you are not hurting yet, but more than likely the tooth, it looks like you need a root canal. So when you do a root canal treatment, or we call it as a RCT, or what we call as root canal treatment, for example. So Either you are hurting or you may not hurt yet, but you have a bigger cavity. So the root canal needs to be done. When they do the root canal, either your dentist or your root canal specialist or an endodontist, they do the root canal for you. They completely remove the nerve from inside the tooth. So now, because they remove all the blood supply and the nerve inside the tooth, and now that's why it's called a dead tooth, because it does not receive a blood supply, it does not have the nerve to it. So when it becomes a dead tooth, now you have a root canal for this tooth. Depending on where the tooth is, you may or may not need a crown. For example, on the front teeth, if you have a root canal, can you possibly get by without having to do a root canal? Yes, the answer is yes. Although the tooth may become brittle because it's a dead tooth, you may get by without a root canal on a front tooth because it is not a chewing tooth. On the back teeth, more than likely we are going to recommend after the tooth becomes dead, when you get a root canal, you are going to need a crown because the tooth itself becomes brittle and you don't want to end up chewing actively on those teeth where you have the root canal or where those teeth are dead, and you're going to end up breaking them because now the tooth is dead. You are going to put the same function as a live tooth. Now you're going to end up breaking them. So our recommendation at that point is you need to have a crown for those teeth. For the front teeth, can you get by without crowns or veneers on those teeth? Possibly yes, but sometimes what happens on those front teeth when you have root canals done, the tooth starts to change color. So when you have a dead tooth, when it starts to change color, at that point that tooth may need a crown, even if it is a front tooth. So what needs to be done? When is a tooth called dead? When you get a root canal, the tooth is called dead. What needs to be done for a dead tooth? More than likely you may need a crown for a dead tooth, depending on the position of your tooth.
You know, it's all really interesting. I actually had a dead gray tooth when I was a kid for about 5 years, right up there.
There we go.
Yeah.
There we go. You know exactly what I'm talking about.
I know exactly that.
Yes, sir.
All right. Let's go back to Facebook for our final questions of the night. Let's see. Next question comes from Abdullah Sabir. His question is, I have Medicare. Can you take Medicare patients?
So the question is, I have Medicare. Can you take Medicare patients? In our office in this location, we do not take Medicare patients, and I wish I could help those Medicare patients. With the way the healthcare system is, our hands are tied as far as being able to help Medicare patients. Can I help Medicare patients with possibly a free consultation? We will be able to help you. However, when it comes to treatment, we will have to find a provider who are specifically assigned for Medicare patients. Can we help you find a provider who are specifically assigned for Medicare? Yes, absolutely. We work with multiple type of providers and multiple level of providers. Either they are general dentists or they are surgeons or other type of providers, and they do have the ability to treat Medicare patients, and we will be happy to help you. And the best thing that I recommend you do is to avoid a lot of inconvenience. You call your Medicare helpline and ask them who are the providers in your area. For example, when you call your Medicare helpline, you can ask them, hey, can you recommend a dental provider in my area? Ask them for 2 or 3 recommendations. You can also ask them, hey, can you provide an oral surgeon in my area who is a Medicare provider? You can again ask for 2 or 3 names. And after you get those names, talk to your friends or family. More than likely they may know one of them, or if not, just do some online research which one of those providers have the best reputation in the area, and go see them, and they should be absolutely able to help you. And I'm sorry, at this time we do not take Medicare, but at some point we may end up start taking Medicare. At that time we should be able to help you in our office.
Yeah, and if you're dead set on coming on in to see us, we also offer a variety of payment plans and credit options to get you the help that you need.
Absolutely. Thank you very much for saying that, Reese. So this is what happens in my office, and a lot of times patients are not only tired of calling the Medicare helpline, and not being able to find the right provider, or when they go to the providers and not being given the right options. And so in our office, and we do have multiple and variety of flexible and affordable payment options that are available that may fit in your budget. And it doesn't hurt to come and see us. If you happen to be in the Dallas-Fort Worth area, come see us and we will find possibly a solution that's going to fit your budget. If not, we will be happy to find a provider that's going to fit your needs.
All right. Let's see here. This question comes from Miss Lucretia Stanley Strawberry. Question is, I just had all my bottom teeth cut and pulled out at a place in Denton. They messed my mouth up so bad, it's awful. I can't even wear them. What can I do?
So the question is, I just recently had my teeth pulled out and I had a denture made. Now I do have a pair of dentures, but I can't even wear them. What do I do? Can I help them? Absolutely. So this is one of the common problems that I see. So when the teeth get removed, if they are not done by a proper specialist, just like we had talked about earlier, Reese mentioned, and this is what we do all the time. We do remove teeth all day long, and when we remove them, not only just yank the teeth out, we do the proper measures that needed to be done to seat a denture. So for example, if you remove all the teeth and if you don't properly prepare the bone to receive a denture like this, now it's almost wearing a flip-flop on like a thorn of bones. You got some thorns sticking out or some bones sticking out. Now you're starting to wear a denture. It is not going to be comfortable for you. What we do in our office is not only just remove the teeth. Of course, we would love for you to get some implants. Even if you're not going to get some implants, we just completely prep the bone or smoothen the bone in a way for you to receive the denture properly. That way the dentures are comfortable even if you do not have implant. So it sounds like I cannot tell you without looking at you what the problem is. So it sounds like you may not have received the proper care from what I'm hearing, or you may have received the proper care and your dentures may not be fitting properly. My recommendation is go back to the provider and ask them whether they will be able to help you, and that is the best way to get this problem resolved. Of course, if they're not able to help you, if you happen to be, sounds like you are in the Dallas-Fort Worth area, come see us and we will be able to help you. Talk to Reese and he will be here tomorrow, even Friday morning, and he should be able to make an appointment for you, or go to our website implantsgumcare.com, or go to our Facebook page and make an appointment or make an appointment request, or call our office and or text us even, and we'll be able to help you either with just from either relining a denture or smoothing the bone or give you some implants, and we will be able to help you with a variety of procedures that we offer in our office. And to go back to your question, can we help you even if the dentures do not fit, if we had some recent extractions done? Yes, we can definitely help you.
Yeah, and if you've lost trust in your dental provider, just come see us. We'll help you out. You can trust us. All right.
Thank you, sir.
Next question. This one comes from Miss Linda Heron. Her question is, what is the cost for denture implants, and is financing available?
So the question is, what is the cost of denture implants, and is financing available? So the denture implants, the first part of the question, what are the denture implants? The denture implants are anytime you have a denture, these are the dentures, and you remove the teeth and then you fit them with a regular denture which is not secured. And I tell my patient these are like flip-flops, or we call them a grandma type denture, which stays in the bottle. It does not stay in the mouth. A lot of times, and sometimes during nighttime, you always have to take them out. What the denture implants are, in addition to doing a denture, you secure the denture with some implants like you see down here. This is the bottom jaw, and you put some implants. Now the denture has an attachment like you see here, Now you're able to snap the denture using the attachment onto the jawbone like this. It clicks, and you may or may not have heard that click. So now when you pull the denture out, you just cannot pull it out, and it's not like a flip-flop and it flips and flops around just like this. So this is going to be a flip-flop. This is a regular denture. This is an implant denture. It does not flip-flop, and it is secure, so it is attached to the bone. So that is the first part of your question. Can you get denture implants, or do we do denture implants? Yes, we do. So do we have some financing available? Absolutely we do. So depending on what your budget is, depending on how much you are able to fit into your lifestyle, depending on what you need, either you may need a regular denture that may just need some relining, or you may be able to get away with just the two denture implants in the bottom, or you may need 4 denture implants on the top. Depending on whatever your budget is, we will be able to help you. And again, if you happen to be in the Dallas-Fort Worth area, come see us or make an appointment in our website, implantsgumcare.com, or give the gentleman a call, Reese a call tomorrow, and he should be able to help you. Or text us, call us, make an appointment on our website. We will be happy to help you anytime. Again, there is absolutely no cost to come and see us because we do offer a free consultation and a free CAT scan.
All right, looks like we have time for about 2 more questions, so let's get to those. Next one comes from Miss Irma Ramirez, and it says simply, I need help for bad breath.
So the question is, what can be done for bad breath? So this is one of the most common problems. Bad breath is one of the most common problems that I see in my practice. So a lot of times what patients don't know is bad breath, one of the most common problems that they need to be aware of is the problems in their mouth, which happens due to either some gum disease because of the disease of the gums, or because of the bad teeth because of the disease of the teeth. So either it could be the disease of the gums, or it could be the disease of the teeth. So if you happen to have gum disease and disease of the teeth, or broken teeth, or cavities on your teeth, you got a multitude of problems. So the bad breath is not going to go away if you fix just one or the other. You got to address all of those. So if you have gum problems, you can come see us at Implants and Gumcare. We will be able to help you. At the same time, we may be able to remove some of the badly broken teeth, which are the source of your bad breath. And also, if you happen to have any cavities, we will be able to find a family dentist for you who can fix the bad teeth, or the teeth with the cavities, which are the problems for those bad breath. So to go back to your question, what causes bad breath? Gum disease, broken teeth, or cavities on the teeth, or a variety of problems such as broken partial dentures, or old partial dentures, or old dentures, or failing root canals, or abscess or pus pockets. So multitude of reasons can cause the bad breath. So talk to your dental provider, and if you happen to be in the Dallas-Fort Worth area, come see us and we will be able to help you.
All right, let's get to our final question of the night. And it comes from Miss Amanda Lasoya, and it is, my gums are turning purple bluish. What does this mean?
So the question is, my gums are turning purple to bluish. What does it mean? So purple to bluish gums, sometimes we normally say it's because of the gum disease. So sometimes it very rarely it so happens, and it could be due to the type of pigmentation or some kind of a discoloration that you may have on your gums. Depending on your ethnicity or the race, you may have a tendency to have a purplish or some kind of a blue or a black gum. It may be normal for you. But if it is not something that you are born with or you had it for a long time, but if the gums are starting to change to purple or blue recently, it is possible it is related to the gum disease. Possibly, more than likely, because of the gum disease, you may have ignored the gum disease for a long time. Now you had some tartar, severe tartar growing under the gum line. Now the gum may have stopped bleeding, but you were able to see the tartar going under the gum line. Now it's starting to change the color of your gums. That is one possibility. Or you may have some gum disease, but if you're a smoker, sometimes the smoking will mask the bleeding because of the constriction it causes. It will mask the bleeding on your gums. Now your gums may start to change purple or bluish because of the gum disease, but it does not bleed because you're a smoker. So either way, either you are a smoker or a non-smoker, and it could be due to either the tartar or it could be due to some regular gum disease. So more than likely it is because of the gum disease. If you happen to be in the Dallas-Fort Worth area, we are the expert in gums and we can definitely help you. Come see us at Implants and Gumcare. Either call us, text us, or make an appointment on our website and we'll be happy to see you. If you happen to be out of the Dallas-Fort Worth area, wherever you are, go see either a gum specialist or a periodontist or your local family dentist, and they should be able to help you.
Absolutely. All right, well, that does it for us tonight.
Well, thank you so much, guys, and we really appreciate you guys taking your time out of your precious night and spend the time with us. And this is a place for you to get all the truth, whatever the teeth belongs to. So any truth that you want for the teeth, just submit your questions on Facebook, Quora, or our website, or call us, text us, or email us, and we will be happy to answer your question. As you guys know, Reese and I, we do this show every month, and I'm so glad, we were able to share the wisdom tonight. And thank you so much again, and we look forward to seeing you all next time. Until next time, take care.
See you later.
See ya.